this week, boom, all of a sudden they got racial breakdowns of demographics. And I don't know, I want to dig into a little bit of like why, what factors do you think are contributing to those numbers being what they are? You know, I've talked with my friends and family, and everybody has their theories, you know, but I wanted to get your theory from a healthcare professional. Like, why do you think definitely those cities, if you talk New Orleans, Chicago, Detroit, you're talking about Black people. Okay, here's Dennis coming in.
Connected.
Is he there? Yeah. Seemed to thing come up that he was joining in.
I see him.
Okay, I can hear you.
What's going on?
Hey, bro, how you doing, man?
I'll do this on gallery. Let me put it on. There we go. So first, let me make the introductions. I got, you know, Dennis, L.A. White. We've been colleagues, friends, and been following his acting career all the way back to the Notorious movie. When I first did Junket, I think we met shortly after that. And we even hung out in Atlanta at my high school reunion barbecue a couple of years ago.
Yeah.
So
I love
we've been good times, you know, off work. And then Dr. Rachael Ross, I went to school with her, went to undergraduate with her while she was doing her pre-med stuff before she went on to Meharry and doing all type of great things on TV and her private practice, or medical practice. So we had a conversation this last week, me and Dr. Rachael, about just kind of some of the real behind, you know, the COVID-19, the corona crisis that everybody is facing here in America. And it was, and you know, I've been following your story that you had tested positive for it. So I thought it'd be great to have a follow-up conversation where we could talk to somebody that was the actual victor and defeating corona in his body, and is here to tell about it and give us some real perspective to share with our audiences. And also to talk about, I was just telling Dr. Rachael right before he jumped on that last week we talked about the racial disparities, or were there racial numbers, because a lot of people at the beginning of this, including me, I'll be honest, thought that maybe, you know, maybe this Black DNA is like is fighting off the corona.
We wish, right?
Mostly because the numbers in Africa were what they were when it first started off, and I thought it was a sign that that continent was handled a lot better than Europe and Asia, and now America. So that's a start off. Welcome here, Dr. Rachael. Back to our first question to you, like these numbers that came out this week, like, I mean, what do you think of some of the contributing factors that's saying that African Americans are more susceptible to this virus than other people?
Sure. Well, I gotta, you know, whenever you ask me that, I've got to calm myself down a little bit and come up with the politically correct version of the answer. So let me pause for a minute. Okay, but I think one thing to keep in mind, I don't know if you saw the article. Did you guys see that Newsweek article about the 600 African American people, folk who descended upon a ski, like a ski weekend a month or so ago, and 100 of them left infected with corona, including the DJ Jazzy Jeff, and proceeded back into our communities with coronavirus. So I think that I think the outcomes are a number of things. One, I think we just have to put it out there. I think that sometimes part of the concept is that you know, African Americans have always been a disposable group of people, right? And so as a result of the fact that we do have more chronic illnesses than anyone else, you know, whether that's because of lack of healthcare, whether it's because of economics, whether it's because of the knowledge isn't out there. We don't really have professionals giving us real information other than take this drug, take this drug, take this drug. You put all of that together and you end up with a ticking time bomb. And when this first started, I said to everyone around me, I said, oh my God, this is going to really hit our community hard, particularly the piece that comes out of Italy where they say that, where we found that it was hypertension, where we found that it was type 2 diabetes. And look around you, how many people do you know that look very healthy and so on and so forth, but they're taking blood pressure medication? That's us, that's our community. And so as a result of it, all of this, is upon us. And now we're sitting around struggling, trying to figure out what can we do to decrease transmission. But I think at this point, we have to deal with the fact that it's there, it's going to be there. And what are we going to do to try to make it so that we survive it and that we have outcomes like Dennis did? And so I'm excited to talk to Dennis because we see so many people who don't make it, and the media doesn't put enough information out there about those of us like Dennis who, for some strange reason, his immune system kicks in and does its job. So I'm so excited to talk to you, Dennis. And just know, you're providing so much hope to so many people. So many of us who are just stuck in our houses, worried, what if my mama gets this? What if my brother gets this? What if my husband, my wife, all of these things. Just so please tell us. I love that smile. Thank you. It's good to be alive, right?
Definitely. Well, touching on the subject of the difference in African Americans getting the virus, my thought process on that is, first of all, initially, once again, we didn't think we could get it. I don't know why. We thought we were, blessed not to be able to get it. And we haven't been really practicing social distancing. And a lot of the cities that have a lot of influx of it, New York, Chicago, Illinois, New Orleans, have a lot of impoverished Black people. So it's hard to social distance yourself when you living in the PJs, so that's one thing. And also the hospitals are turning away a lot of African Americans. I know someone in Chicago who had symptoms, went to the hospital, and they turned him away, and he ended up dying in his sleep with the COVID-19. So that's attributing to the increase in numbers of why we're growing in population with the COVID-19.
I think you hit on a point, Dennis, that we can never really get past, is the fact that when African Americans show up in the emergency room, we know for a fact that our complaints are taken less seriously. Study after study shows the same thing, that we are underdosed in terms of pain medication, that our complaints are brushed off and we're sent home more than any other group that exists. And so you compound that with the fact that now coronavirus is here and we're getting a chance to see this exponentially. So thanks for sharing that about your friend.
Dennis, can you take us back to, when you first started getting sick, were you ever able to pinpoint the point of transmission, the day that you might have got it or whatever? And can you take us through just a little bit about your story about how this process happened for you?
Sure. Well, because of how volatile the virus is, there's no way to pinpoint when you get it. I know the week before that I was having symptoms, I was really traveling a lot. So I was filming a TV show, The Family Business, in LA. And so that Wednesday before, I flew from from Atlanta to LA for 3 days to film. Then I flew from LA to Charlotte for the CIAA. And then I took a rental car from Charlotte, drove to Atlanta on that Monday, and then flew to LA on that Tuesday and flew back to Atlanta on that Wednesday. So that traveling on airplanes and coming, big groups of people, there's no telling who I came in contact with that exposed me to the virus. So I flew back on the 4th. I had a screening for a TV series I directed on the 5th. And then I hurt my leg on the 5th as well. But on the 6th is when I started, getting body chills and my temperature was 103, 104. I had my cough starting getting really intense. You know, we're in the season where, you know, everyone has a little cough here and there, but it got so intense where I was coughing like 30, 40 times in a row. And I couldn't, it wasn't like I was coughing up any phlegm. It was just a cough, and it was painful to cough. So, you know, once again, I'm not,
was that the first day, or did it take a minute for the pain and the cough to start? Was that
the pain, it wasn't initially. I had body pains and body chills, but the pain in my chest and my stomach kind of evolved like around the third or fourth day. Yeah. And it was just uncontrollable. I couldn't stop the coughing no matter how much. And, you know, I knew that the next weekend, next Saturday on the 14th, I had to fly back to LA to film. So I'm like, well, I got to get better so I can go back to work, you know, and it just wasn't getting any better. It was actually getting worse. And I was self-medicating and, you know, didn't want to go to the hospital. Was like, I'm not going to the hospital. I'll be fine. You know, it's just a little flu. I've been running my body down, but it wasn't getting any better. So
now this is early February now. So were you?
No, this was actually March 5th.
Oh, March 5th.
this was
Okay.
March.
So
Okay.
like from January, February, I've been traveling back and forth. So, you know, I would be under the weather here and, you know, push through it, you know, try and get some extra sleep on one day or, you know, but I was never like 100% well, you know, but it hit me hard March 5th. And
Let me ask you something real quick, Dennis, before you tell us the rest of it. I noticed that you said you were traveling back and forth and on the airplane and so on and so forth. Did you have in place kind of like a self-care regimen for all of this? Were you eating right? Were you hydrating? Were you managing your stress? Or do you feel like you were kind of, you know, like just running on fumes? Because to me, all that flying that you said that you did, I was just like, gosh, he's making me tired thinking about it. So how do you think your health was, you know, kind of leading up into this?
Well, here's the thing. So I'm used to going hard. So traveling crazy. So it was just par for the course. But the answer to your question was no. I wasn't eating right. I wasn't getting proper rest. My health regimen wasn't consistent. You know, I would take an emergency here or there. You know, I'll do a like some NyQuil. You know, just, you know, I'm in a hotel. I'm like, let me get something to kind of, you know, just get me over. You know,
Sure.
and so I'm partying. I'm going to events. You know, I'm just really doing what I've been doing for 20 years. You know, in the business. I just, you know, being out there on the scene and doing what I had to do. So, you know, but being exposed to, I guess, the COVID-19 really took a extra toll on my body. And when I was admitted, I had double pneumonia. So I've been, you know, it's been building in my body for a while.
Wow. So talk to us a little bit about, you get admitted into the hospital, you know, you finally, you know, because I know a lot of times professionals are giving the advice, stay home. If you feel sick, you feel symptoms, stay home. What was it that made you say, you know what, I need to go to the emergency room? And then what happened when you got to the emergency room?
Well, two things. One, I was trying to go before I had to fly out on Saturday, just so I can, you know, get something to subside so I can get on a plane and go back and film. So that was like, well, I'm gonna go and they're gonna tell me nothing's wrong. And then my girl was pushing me to, and my mom and my family was like, yo, you need to go to the hospital, like, stop it. So it was the culmination of that. And I went to a doctor on a Wednesday before I went to the hospital, and they gave me a flu test. I didn't have flu, and they were like, go to the emergency room. So they gave me a Z-Pack as well. So that was Wednesday, Thursday, and Friday. I was taking the Z-Pack, but it wasn't helping. So I was like, okay, let me go. And when I got there, they were like, oh, we got to keep you. So they x-rayed my chest. They gave me a CAT scan. It was really intense. And, you know, I was in there for 8 days.
when they did the CAT scan, did they come back and tell you, you know, based off of what we see on the CAT scan, we think you may have COVID-19? Yeah.
Yes. Yes, I had
Mhm.
all the symptoms. So when they submitted, they gave me the test. The CDC didn't accept it. They didn't want to accept the test because I didn't meet all the criteria, which the only criteria I didn't meet was that I didn't travel to Japan. To China, which is really stupid.
This is March? This is
Yeah.
happening in March.
Yes.
Wow.
So that was the only criteria that I didn't meet that made them not want to accept my test. And so the doctor was very forceful and it's like, you have to test it. So they finally did test it. And they came back on the 16th. They called me and told me that I was negative. I didn't have the COVID-19. So I'm rejoicing. My mom, my girl, my family comes, they're happy I'm doing better. I still have double pneumonia and I'm still in the hospital, but, I don't have that. Then 11
So
o'clock that
tell me
night.
this. When your
Yes.
family arrives at the hospital, were they able to come into your room and celebrate with you? Were they outside of the room? Did they have to gown up?
Well, this is what was crazy. So my mother came before I got the call and to bring me some stuff. And they let her come to my room with a mask, glove, and a gown on and everything. And so I got the call while she was there. So they took the quarantine sign off my door. They told her to take her mask, gloves off, the gown off. I'm good. The nurses took all their stuff off, so they were coming in, and so 11 o'clock that night, the doctor came in and said, we apologize. There was an error. And, we had your name under someone else's results, something like that. And you do have it. Yeah. Yeah. So now, not only am I affected, but I put my family and loved ones in jeopardy as well.
Wow.
So, yeah. So that's what I was dealing with. Uh-huh.
That's amazing. I know it's shocking to hear, and I heard this before on the last live I was listening on. You were saying it. It's every time I hear that, I was like, how could they not have been overly cautious instead of being, it's just amazing.
Reckless. Yeah.
What city were you in? Was this Los Angeles or Atlanta?
No, this is in Atlanta. This is in Atlanta.
Wow.
The home of the CDC.
So so it was the CDC that messed up. It wasn't the hospital. The hospital, I went to Wellstar. They took great care of me. So the CDC tried to contact me and, if your family needs anything, let me know, but they would not give them a test. They would not test them.
Even after they were directly exposed, they still would not give your family a test. At this point, I think it's a good point to remind everybody of the history of the CDC, okay? So this organization that is so in charge of our healthcare and is so guides every health decision that's made in this country was the same organization that gave us the Tuskegee Project. So at some point, questioning what they're doing, I think is in order. This is crazy. I didn't even know that, Dennis. I'm so sorry.
Yeah.
I can't imagine the anxiety that you must have felt on top of just trying to fight through something like this.
True indeed. Yeah.
And did any of your family members or anything get any type of sick where they thought they might have?
No, thank God they haven't shown any signs of the virus. They could be asymptomatic, we don't know, but they haven't shown any sickness. They had a home 14-day quarantine, but nothing has came up.
Yes, and so all of this was just a few weeks ago, actually, then, right?
Correct. Yep.
So then at the same time, your family has to continue being cautious because we keep hearing all this misinformation about the incubation period and showing positive testing and so on and so forth. There's just so much out there. Wow. So Dennis, how do you feel you've recovered? So, whenever anybody has a lung infection or something like this going on, there's scarring, your lungs have to improve. Do you feel like you're still a little short of breath? Do you feel like you're back to 100%?
I'm not 100%. When I got home from the hospital, it was a challenge because I tried to work out and it was like, no, And so just walking, doing different things, you know, was folding clothes. I was out of breath. So as of right now, I'm not 100%, but I'm a lot better. I'm like maybe 90% with my breathing. So, you know, I still have a little cough. They gave me Mucinex and stuff like that, and to try and get rid of it. But I feel so much better than I did.
Oh, that's great.
I'm on the mend.
Now,
You
have
know,
they tested you again to say, okay, well, we test you again, and we know that you're negative now, or did they just say, well, you're feeling better, it's been 14 days, you probably don't have it anymore?
That's exactly what they said. And so I have a virtual appointment with my doctor on Monday.
Virtual?
Yeah,
How's he gonna listen to your lungs virtually?
you tell me. So, you know, I had that on Monday. And so right now I'm stalking out places to get tested for me, you know, just to make sure that I don't have it, or or if I still have it, to be mindful. So that's what I'm working on now, trying to find a place. It's not readily available.
Not.
Testing.
wow.
No, it's not. Did they, on discharge, did they talk to you anything about, you know, what you should be doing going forward in terms of your immune system, how to build up, back up lung function, and they give you any exercises to do, foods to eat, things to avoid, things like that?
No, not really. Basically, they told me just rest, take it easy. You know, I had a 14-day quarantine. The doctor he was cool. He was a nice guy. He was like, I'm gonna be honest with you, Dennis. We don't know anything. I'm not gonna lie and tell you certain things. You know, I can't tell you. You know, we believe that after the 14 days, it leaves your system. So I want to give you an extra 14 days of quarantine just to be safe. I can't tell you if you can get it again, because we don't know. You know, the cases that there was like 53 people in Wuhan who retested positive. They don't know if the virus left their body or not. It could have still been in there when they got tested.
Right.
So that's why, for me, it's adamant for me to get tested now, so I know where I am and what's the circumstances. As far as what I went through and the pain and everything, all that is gone. Thank God. You know, I'm a whole new creature again.
Oh, that's great. At any point, did you think that you weren't going to make it?
Yeah, there was a point in the hospital where I was hallucinating, and I couldn't catch my breath. And so it always happened at night when I was trying to go to sleep. So it felt as though, like, if I went to sleep, I wouldn't wake up. So I was fighting it. My body was not, like I was falling off a ledge or a cliff, and my body was fighting it, wouldn't let me go to sleep. It was like, you know, coming up. And so I didn't really sleep a lot in the hospital. I didn't eat that much as well, but it was a couple days where I felt like if I had went to sleep, I wouldn't have came back.
Wow.
Yeah.
Did they ever have to put you on the ventilator?
No, I had just oxygen. They put the oxygen because, you know, I didn't have any major medical issues. I didn't have asthma, high blood pressure, any heart disease. I didn't have any of that. So thank God. You know, there's a lot of people that are passing have other issues that makes it complicated.
Mm-hmm.
Dr. Rachael, I'm wondering, as a medical professional, I know that they will have like medical journals and everything else, but how readily available is new information about the virus to all physicians where y'all can tap in and say, hey, well, we now know this, we now know that. How does that get disseminated to doctors across the country, or does it at all?
That's a great question, and it does. Like, so now we actually have 500 plus papers that have been published on COVID-19, you know, within the past couple months, all the way up from February all the way through. So the information is readily available. I think part of the problem, though, is that there's always some people who are disagreeing with certain studies or so on and so forth. So for instance, in China, they had a lot of success, but you know, who trusts China, with 1,000 milligrams of vitamin C every hour over the course of 6 days. And then, you know, so there's all of this stuff that's coming out. But I think too, typically, like for instance, when we're talking about the blood pressure medicine and how there's about a lot of controversy about it, you know, there's always going to be two streams of thought on it. And so since nobody's coming forth and making, you know, declarations, like nobody has really said, don't use ibuprofen. Nobody has really said, don't do this, that it still gives doctors the leeway to kind of say, okay, well, I think this, or I don't think this, or I don't know this, because, you know, if you're not checking these listservs every day, then, you know, sometimes you miss the new information. And by the end of the day, you're like, what? That came out today? So yeah, the information is available, but you do have to go looking for it, you know? Yeah.
It's crazy because, I mean, we started off the conversation talking about why may it be so prevalent in the Black community. And then, I mean, just from, I mean, I know we have a small sample size. He's living right here in the flesh on our screen. You know, we hear the process you went through. And I mean, you're an actor, people know you, you know, I could imagine how this situation could play different for a lot of other Black people in the same situation, and it's scary. Like, so these numbers, it points to. I hear a lot of people now, you know, pushing more that we should get back going earlier, and I wonder in their mindset if they're saying, well, it's just gonna be Black people that's gonna be dying anyway. You know, fuck it, let's get back to work. You know what I'm saying? Like, I wonder if that's their mindset or what's going on in the mindset, because there's so much politics at play in this in our recovery and our reaction to as a society to what's going on. But I gotta admit this, I was that guy saying, nah, it's not gonna get me. Or maybe I already had it, but some of the symptoms when you talk about the serious loss of breath, I was short of breath and tired. I lost my hearing was clogged up like I was in an airplane for like 8 days straight. Like it was like I had to pop my ears, and I was like, maybe I had it, and you know, maybe I'm good, so I could walk around the streets. Not really, I was walking around the streets, but I like.
Yeah, I know a lot of people like that. I know a lot of people that, you know, reflect on it and was like, yo, in January, man, I was sick as a dog. Or December, I was sicker than I ever been in my life. And, you know, we didn't really put two and two together with the coronavirus, but I feel like a lot of people have had it and didn't know, or they were sick and it was just thought it was a regular flu. And some people have it right now and, you know, they asymptomatic, they don't have any symptoms, but they're carriers of it. And so, you know, I had a friend tell me that him and like 40, 50 of his friends was having a quarantine party, and they was gonna cook out, drink, and party and everything. And he ended up seeing my video online, and before on the way to the party, and he called all his friends, put it in the group chat, and like, we got to cancel the party, you know, and they actually canceled the party. And I was like, you know, so I feel like I'm a vessel. I feel like it's a blessing. You know, people hearing my story is helping them to understand the severity of it.
I love that, because I mean, I think at the end of the day, one thing I know as a physician, as a scientist, you can't control the virus, but we can control the host. And what that means is we can kind of control what we do and control what's going on with us a little better. So, I mean, I want us all to keep in mind that 60% of all American adults have an underlying health condition, you know, so, and then if we look at the African-American community, that number even climbs even further. So I think at the end of the day, what we have to talk about is, yeah, it's heart disease, yes, it's diabetes, but it's also obesity, it's also hypertension, it's also those things that we struggle with in our community that we haven't really gotten a handle on because we're constantly, maybe we're gonna juice this week and then get back to what we were doing before, like our health regimens need to just kind of step up a little bit, because if they don't, this virus isn't going anywhere. And if they don't, we won't have these positive outcomes like Dennis had, and we'll have a lot more people, succumbing to the virus. So I'm so glad that Dennis has decided, that you've decided to kind of share this with us and, stay real open about it and keep the information flowing. It's great.
I wonder, Dennis, like when you feel like you're 100% back, like what? Not that this was ever your fault that you contracted it, but what is there something that you're permanently going to do differently now than you were before you contracted this virus? Is there anything that, just out of reflection, you like, it's peace sign instead of dapping up, or what? I mean, like,
that's a great question, because, I'm an affectionate person. So when I see people that I love, I want to give them a hug and give them a pound, stuff like that. But I feel that what I would be more attentive to my health, as far as, taking vitamin C. I'm taking elderberry gummies right now. This being more mindful of my health, traveling, gloves, mask, like full, really be careful. Because during the time I was traveling, I did wear a mask, but I wasn't consistent with it. I wear it on one flight, and next flight I don't wear it. I just wasn't consistent with it. So that's probably one of the major things. And also get rest. Give my body a chance to replenish the energies and the stuff I need for my body. We in this entertainment, sleep is at a premium, and we don't do it a lot because we're always on the go, and we're always trying to chase the next check and the next opportunity.
No, that's great. And I'm so glad you said that, because on a daily basis, there's so much we can all do to boost our immune system. I mean, like a study came out years ago that basically said that after you take in 300 calories of sugar, that your immune system decreases about 50% within that following 2-hour time. So when you think about the immune system and how fluid it is and how much we can do to manipulate it, you said the key things: getting enough sleep, getting some exercise, getting sunlight and vitamin D, making sure that your air space isn't dry. So when you're flying, you get dehydrated, you're not drinking enough fluids, there's no humidified air in the airplane. So making sure that the air that we breathe in at night and in our homes is humidified, making sure that we're eating right, making sure we're getting good fruits and vegetables, eating organic as much as possible, particularly for like Dennis and people who travel all the time, because when you're out, you don't have any control over what you eat, but when you're home, you do. So making sure that the stuff that comes into the house is like clean and, hormone free and antibiotic free and pesticide free is just golden. It's great. Love it.
Yeah.
I was wondering, Doc, also, like, just thinking about, our community. I don't know the numbers. I don't know how many, registered nurses are African American women or men, but I know a lot of them. And when we look at these numbers and how it's affecting the community, how so many medical facilities said they was under-equipped or not have enough PPE. A lot of these RNs, I mean, one senior living home had to be evacuated yesterday in San Bernardino County in Riverside because the staff wasn't coming no more because so many of the senior patients had got sick and they didn't feel like they had the equipment to be safe. How much is that also playing a part of that? A lot of Black people are on the front line of this fight for COVID-19 in so many ways.
Listen, we are on the front line. We're not only as healthcare providers, but as bus drivers, as, the people at Walmart, so we're still in these essential positions. And one of my coworkers said it best the other day. He's like, I can't afford a quarantine. You know, I can't afford to take off. So besides being in the frontline position, but also having mounting debt and kids to pay for tuition and all these things, makes it so that even when you're in those frontline positions, oftentimes you don't have the luxury of saying whether or not you're coming to work or not, right? Who can take off for like 2 months willingly? You know, I think that's rare in our community to even be in a position to be able to do that. So besides our healthcare workers, we got to think about the people who are still serving food, you know, people who are interfacing with everyone at CVS and Rite Aid and Walgreens, all of that. We're so on the forefront because of where we are in society that all of that plays a role in it, definitely. And I love that Dennis talked a little bit about how poorly we were doing with social distancing. You know, we still want to get our hair done, we got our nails, we got to get lined up. So I think, you know, we feel almost, you know, I think at the end of the day, all of us feel a little invincible. And so seeing people like Dennis and hearing stories and seeing your Facebook friends lose family members and everything, I think for all of us put it in perspective, because even as a healthcare worker, I was like, something about this doesn't add up, right? When all this started. So I think, you know, we're already skeptical of everything that they tell us, right? Because we have reason to be, but I think all of that played into the situation for disaster. And unfortunately, I think it's going to continue to play into it. So for those of us who are stuck at home, this is a perfect opportunity to start to change our physical milieu, you know, like since we can't control the virus, we can control the host. So recognizing how to minimize stress, how to eat right, how to exercise, all those things that we've kind of do here and there every now and then, because Black folks buy more turkey bacon, we buy more vitamins, we buy more of that stuff than any other culture, right? And then we feel like it's going to supplement for all the other stuff that we do, hanging out late, smoking a whole bunch of cigarettes, you know, like all of that stuff. We feel like those few little things are going to put a Band-Aid on the bigger problem. And so I would love to see, you know, at this point, all those people who have those online exercise programs, I hope people are enrolling in those and, you know, really, because honestly, exercise is one of the biggest boosters of immune health. So we don't have to take this lying down. We don't have to say this is just going to wipe us all out. But what we do have to say is that we're going to make some changes, that we're serious about it, and bam, you know, put them into play.
Yeah. And lastly, before we wrap this up, I think one of the postures of Black people is also not to trust the government. And when we get these directives, we never know which way they're trying to play us. Like they try to play us for a fool, or they try to help us. And I know I heard from a lot of people, like, you know, I've been worried about cops killing me every day while I'm worried about COVID-19 now. You know, people like have these type of attitudes. I think that have a lot to do with, you know, how we're taking it. And then with a lot of people on the bottom, they don't care what takes them out. They like, you know, like, I'm just fighting to survive every day anyway. What's the difference if it's COVID or I'm hungry or I'm on the street? So it's a lot. It's a lot to go into, like, analyzing those numbers. And it was interesting how the news portrayed those numbers yesterday. Like it was like some brand new thing. Like, hey, we got these numbers. Black people are fucked up. They're dying all the time, and they're dying at a higher rate. And that's what it is. And it just, I was like, wow, so much context to that nobody's talking about. And that's why I was excited that those numbers came out. I was excited that me and you talked on Facebook earlier this week, Dennis, and we was texting, and that me and Dr. Rachael had already said we was gonna have a follow-up. So it all just fell in good timing that our audiences collectively could hear this message, and hopefully, you know, we could continue to work on these solutions. I'm gonna exercise more. I'm definitely not gonna believe that the Black people are invincible to the viruses thing. Again, I promise you that, Dr. Rachael. I learned my lesson. I heard Dennis cutting on somebody on Facebook, like, I don't know how Black people thought we could get. I was like, man, that was me. But,
well, you know, we always get the short end of the stick, so we was hoping that maybe this time we come up above, but it just didn't work out that way. And, you know, with the numbers, I mean, it's sad, but, you know, we can turn it around. We just gotta, you know, just be mindful. And I think that we're getting it. I think that we're gonna get it. You know, I feel the media is trying to change the narrative and really trying to, you know, focus on that instead of focusing on how to solve it, how to, you know, to prevent it. And that, you know, our de facto president Slump, he really, you know, didn't do what he needed to do to prevent this situation. Plus, you know, he's pushing this drug in which he has stake in. You know, he's an investor in the drug, so he's pushing this drug right now.
Well, you know what? He actually just has a mutual fund that has part of some Sankofi stock in it, and I bet you if we all checked our mutual funds, we probably have some Sankofi stock too.
I mean, well, I don't know, but you know, I'm sure he, you know, I just feel his ulterior motives around the whole situation. You know, the one thing that, you know, a lot of woke people are trying to say is that it's population control for, you know, us, but, you know, we're not the only ones dying from it. It's, you know, it's vast amount of races that are dying from it. So the best thing to do is to protect you and your family and practice, you know, social distancing, practice, you know, being safe out there, wash your hands, gloves, mask, and just be, you know, cherish family.
I think they really need to come to a conclusion on if this can be, if you could contract it again, because I could see for a person like you that has to go to castings and everything else, if the producers don't know, if everybody else don't know, I mean, it could have an effect on your career going further. So I mean, they need to get the science out of the field. Say, hey, you know, you got the antibody or something. I just wish that science could move faster than, you know, these tests are doing, so that we could just have some conclusive evidence about it. Something. It just feels like we don't know much more about it than we did 2 months ago. To me, like,
yeah,
it feels like we know it's bad, but we don't know how to cure it. We don't know. There's so many questions that's like still like, man, when are we gonna get like some definitive answer about this? But I'm glad we can have conversations like this, man. I hope we can follow up and see you when you're back at 100% and talk to you and be able to tell the audience, because I'm sure somebody that's going to be watching this is probably going through some stage of the process themselves, and then for them to be able to see where you at with it will give them hope. And for those people that's so fearful that if you get it, it's over with. I mean, you giving them hope. You know, just seeing that you there, you healthy, you fighting it, but you there. I hear the birds tweeting in the background.
Yeah.
Peaceful.
Yeah.
So I hope we can do some more stuff like this and we can share with our audiences. I'll make sure I share the videos with you if you're watching and you're not following Dennis L.A. White on all of his social platforms, and Dr. Rachael on all of her social platforms, and BlackTreeTV on all of our social platforms. Just, you know, feel free to follow, share. You could steal this video and put it up, but I'm not gonna trip about it because the information gotta go out. So
yeah.
Just thank y'all for watching. Thank you, Dennis, for participating. Thank you, Dr. Rachael, for participating here with me at the Treehouse for this weekly COVID-19 update. And we out. Peace.
Thank you. Peace.
Everybody be easy. Wash your hands. Love y'all.